All right, so today I just wanted to discuss the lumbar disc herniation and mindset strategies with the patient because we just had one recently. Uh, you know, Disc herniation likely there prior to the accident, 100%. More than likely, shouldn't say 100%, but he had struggled with some on and off pain since we used some medications along with conservative treatment options, and he kept telling me, well, it's still stiff, it's still sore. Sometimes when I'm not doing anything, I still get the that achy pain in my calf, and I would keep telling him, this is we're still in the early phases. The body doesn't heal linearly. There's always going to be kind of ups and downs to the process as the inflammatory cascade and things is going through the system, as the medications take effect, and as the treatment that we're doing, conservative treatments we're doing here, and the activities I'm having you do on your own at home, start to take effect. So you have to, be patient with the process, and it may take 2-3 months to really have improvements in your day-to-day functioning. And he just kept telling me, well, now it's like this and it's like this, and I would just keep reiterating the same things. Friday, so last week, he came in and discussed, this has been his last appointment he had, and he came in and said, I finally took everything you were saying to heart. Quit worrying so much about the like some sort of linear path to healing. Started getting back to my activities. Started doing some, varying how I did things slightly at my job to stay comfortable. And now I'm finally starting to feel a lot better. I'm starting to not have those I'm starting to not have that aching sensation. I'm starting to not have that aching sensation anymore in that calf, and now I can sleep and all those things. So it's just that kind of same old message of that psychosocial aspects of healing, especially when you're dealing with back pain and disc herniations, is you can explain to the person all you want at the beginning about the healing times and the long-term outcomes of these situations and how they're going to continue to improve and how the body will heal. But in the end, until the patient decides that they want to believe you and starts making that switch in their head about how to approach the mental aspects of healing from the injury, then we're going to have a tough time breaking through that. So it was just a great way to see him sit back with me and say, I think I finally understood what you were getting at. I start to feel like my body's allowing me to be more mobile and get back to more of my regular activities and capabilities, and not seeing those big increases in symptoms afterwards. So it's just a big way, just a big thing to understand that your messaging has to stay consistent with a person like this, and then they will eventually start to heal. There's always going to be people that don't get better, and you have to be fine with that as a clinician. There's always going to be folks that aren't going to improve no matter what you tell them or how encouraging you are. But it was just nice to see this recent one go from having continued issues to making big improvements by having that mindset shift and getting back to his regular activities and pushing through. So, there's more and more things on my YouTube channel. I always post these after I go live, so you can always go back and take a look at anything I've done. And thanks for tuning in.